Dr. Wakelee, you mentioned targeted therapies. How do they work?
Targeted therapies are something we can use when we find a specific gene mutation in the tumor. So I mentioned before that in order for a cancer cell to become cancer, something has to happen at the DNA in the cell. And there's a change or a mutation in the DNA of the cell, which leads it to be a cancer. And a lot of the time that mutation happens in a specific kind of gene that makes a type of protein called a tyrosine kinase. And, for those of you who haven't studied a lot of science, it's a word you might not have heard before. But basically, these tyrosine kinases are proteins in the body that make a lot of changes to what's going on in the rest of the cell. So they're sort of what we call regulators. And one way of thinking about them is like on and off switches. So normally their job is to sit, and if the right molecule comes around, that turns it on, and then it turns on other proteins in the cell. And if that molecule isn't there, it's turned off. So it's this on and off switch that does a lot of other aspects of what's going on in the cell. But sometimes a mutation happens that turns it on all the time. So it's like if you leave the light on, it's on all the time. That's using a lot of energy, and that's actually what's driving the cell to act like a cancer. And so we can now look for some of those mutations that turn some of these tyrosine kinases on all the time. But we've also developed drugs that we can use to turn them off. So if we find a specific gene mutation that's turning, say, the EGFR protein on all the time, if we find that, we can have the patient take a pill that then turns that off. And that helps the cancer slow down, some of it die, some of the cancer cells die, but it doesn't completely wipe it out. It helps the patient for a long time, though, by shrinking the cancer, helping them feel better because the symptoms are gone, keeping the cancer from growing. But cancer cells are clever. They continue to divide. They can continue to make new mutations, and eventually they figure out ways around that. Yeah. But when we talk about targeted therapy, it's a setting where we find the cancer. In the cancer, we find a gene mutation. It's in one of these specific types of proteins, genes that make specific protein that turn something on that we can then turn off. And with those pill drugs, we can have a big impact for people.
Mm-hmm. And what exactly is immunotherapy?
Immunotherapy are treatments that were used to help keep the immune system more active. So the immune system is a very complex mechanism. There are cells that their whole job is to figure out and find things that are not us. So they're looking for bacteria, they're looking for cells that have virus in them. And when they find it, they attack. And that attack can be in the form of antibodies. It can be cells that actually go in and attack other cells directly. And we are all familiar a little bit with the immune system because we know that if we get a cold, our body, we can get a fever. That's part of an immune response, and we get better. And then some people know the bad side of the immune system if they have allergies or certain autoimmune diseases where the immune system gets a little bit too revved up and starts to recognize normal things as foreign. So in the setting of cancer, normally the immune system is able to recognize a cancer cell, see that it's different from the rest, and get rid of it. But cancer cells are clever, and they figure out ways to evade the immune system. And one of the ways they do this is they put a protein called PD-L1. So PD-L1 is a protein that a lot of our normal cells use to say, just a normal cell, ignore me. And so when an immune cell comes in and sees that, it gets turned off and goes away. So what our immune therapies do is they actually, most of them are blocking that PD-L1 protein. And when they do that, it's sort of like taking away the stop sign. So you've got a tumor using a stop sign to say, go away, immune cell. You block it so the immune cell can't see that stop sign, and so then it kills the cancer cell better. So that's how these drugs work, and that's the immune therapy. There's some other stop signs besides PD-1 and PD-L1, but that's the most common. So when we're talking about immune therapy, it's drugs that block that. So they increase the ability for the immune cell to recognize cancers. The risk from them is that you can get the body to recognize normal tissue as a problem sometimes. So that's the toxicity that we watch for.